mental health has been on par, hence parity, with the rest of medical care. But as all of you know, it's been 10 years since that bill was signed into law, and we're still struggling to see that it is enforced and implemented. Because for too long in our country, mental health was segregated from the rest of health care. In other words, it wasn't part of what we consider whole care for someone with cancer or diabetes or cardiovascular disease, which of course today you can't treat any of those conditions if you don't also treat underlying depression, anxiety, possibility of addiction. So it's a whole new cultural phenomena that frankly the House of Medicine still is not ready for. We need to demand that people providing mental health and addiction services use evidence-based practices. This seems obvious, but it is rarely done. And so we have to do both together. If insurers are going to pay for the care now in a way that they never paid for before, we better make sure that those dollars go to reimburse care that has an expectation that you are going to get better outcomes and that it isn't some kind of black box that you don't really know whether you're getting better or you're not. I believe in the future we need to have a checkup from the neck up. A checkup from the neck up. From cradle to grave. Our young people need a checkup from the neck up because they need to have a screening as to whether their vulnerability is such for psychotic disorders and schizophrenia. And we know today more than ever about the biomarkers for schizophrenia, and we need to make sure we move quickly because if we intervene in schizophrenia, we permanently change the trajectory of that illness, thereby eliminating the whole pathology of that illness where people are disabled really for the rest of their lives in ways that we would never want for any one of our family members. And a lot of that is preventable if we have the political will to do it.